a cyst is any structure that has fluid trapped in it. So it can occur in any parts of the body actually. So in our field, we are talking about cysts involving the ovary. And then most of the time we are dealing with functional cysts, which are just normal and frequently occurring cysts. Occasionally we get pathological cysts. These are abnormal cysts. They can have implications like even cancerous tissues inside it. A functional cyst is typically less than 3 centimeters and it's quite common when you are pregnant you get such cysts too. When we see these cysts, we normally just monitor the growth. But pathological cysts, as I said, it can develop from any of the many layers that you find in the ovary, like the epithelium. You can get adenomas, germ cells, you can get dermoid cysts, and many other cysts, even fibroid involving the ovaries can happen. So it's our duty to check which is which and what is implication when you have cysts in your body.
Ovarian cysts can happen in any age group, teenagers and school-going children, can happen in the middle-aged women, can also happen in post-menopausal women. Of course, the incidence of happening in pre-menopause is lower, maybe about 1 in 10,000, whereas those who are post-menopausal are higher, about 6 in 10,000. And the older you are, a higher risk of this is becoming more malignant.
Ovarian cysts can be asymptomatic and can sometimes only be found on routine ultrasound. It's because the pelvic cavity is quite spacious, so the cyst has to be considerably really big for it to cause symptoms. Smaller cysts like ranging less than 4 cm can sometimes can go undiagnosed for a few months. However, cysts that are that's large in size can cause abdominal swelling and cause the patient feeling of fullness or pressure symptoms, and they can also cause abdominal discomfort. If this large cyst gets twisted, then patient can present with severe abdominal pain. It's because the cyst is actually being deprived of its blood supply. So when the tissue dies off, this can cause a lot of pain to the patient, and patient will typically present with acute abdomen. Depending on the nature and the type of the cyst, if the cyst is because of endometriosis, patient will have like other symptoms such as painful period. But if the cyst is actually a simple cyst or a clear cyst, patient can actually present with very minimal to no symptoms at all until they are really big enough for the cyst to appear in the abdominal cavity. Then only patient will feel a swelling or fullness of the abdomen.
We can do a simple ultrasound to confirm whether there's cyst or not. And if in certain cases, we may even do an MRI or CT scan to have a better understanding on what kind of cyst are we dealing with, especially those with a big and complex cyst on ultrasound. The second thing that we can do is by doing some blood tests, basically running for a tumor marker or what we call a protein marker. When it's on the higher side, then we'll be a bit more careful as this may be showing signs of cancerous. So with these two tests combined, imaging as well as blood tests, we can roughly know that what kind of cyst are we dealing with and whether is this a normal cyst or it's a cancerous cyst.
As for treatment, most of the functional cysts are usually benign and we just monitor. This is what we call expectant management. So you will be likely to be called up for follow-up, and until and unless the cyst has disappeared, the doctors will advise accordingly. There has been suggestion that maybe to reduce incidence of cysts, you can take pills like this to regulate the cycle. The natural hormones are reduced and following what is given in the pills, so you can have less incidence of cysts. However, it's not clinically proven. By and large, we just go for expectant management and call for follow-up. But when we suspect the nature is pathological, then we have a different management design for you.
Which of the ovarian cysts requires surgery? This would depend on the factors that we will determine when we examine the lady with the cyst. We can get some of the information clinically when we examine the abdomen and look for the cyst and the size. We rely on the imaging features, and here we use ultrasound a lot. So the ultrasound is able to tell us more about the cyst, including the size, texture, whether one side of the ovary is involved or both ovaries are involved. We can also use some color Dopplers to determine whether there's more likely to be a malignant of the cyst. Besides all these ultrasound features, we also will rely on other factors like a family history of cancers. We rely on whether she has any symptoms of pain and discomfort, and this will help us determine. Sometimes we may need to employ other methods of imaging, such as CT scan or MRI to give us information. And once we have all the information, we then decide which lady will require surgery and what type of surgery.
When it comes to surgery, number one, we can either just remove the cyst. Number two, we can remove the ovary along with the cyst. Or thirdly, we can remove the entire female organ, which is the womb, both the ovaries as well as the cyst along with it. It all depends on the situation and more importantly, whether the cyst is cancerous or not. If it's a young and the cyst is just a simple cyst, generally we'll advise for just removing the cyst. In an older age group, or if we really think that the cyst is cancerous, we generally do advise to remove everything, which includes the womb, ovaries along with the cyst, to ensure all the abnormal cyst is being removed from the body.
Hysterectomy can be done via laparoscopy or keyhole surgery or minimally invasive surgery. Can also be done via laparotomy or open surgery, the conventional method lah. Laparoscopy is favoured because it's associated with lower post-operative pain. It's only involving 3 small holes on the abdomen, so obviously patient will feel less pain, and usually it's also associated with lesser complication, faster recovery, and they can be discharged earlier and they can return to work earlier. The normal laparotomy or the normal open surgery is usually be associated with more post-operative pain, longer recovery, and longer time away from work. Not all cysts can be removed via laparoscopic surgery. It depends on the size of the cyst, the nature of the cyst. Obviously, cysts with some solid components or cysts that's large in size and cysts that is suspicious of malignancy, we prefer to do the cystectomy via laparotomy so that you can avoid spillage, so you can remove the cyst intact and prevent spread if let's say we're dealing with cancer cases.